Hello everyone. Good morning, good evening, depending the part of the world where you are based now. We will start the third session of the first day of the Digital Health Forum Recainza 2022, and we will have a very interesting discussion. The topic is virtual healthcare, ensuring access and equity in healthcare on a global scale. Uh, in for that discussion, we have today the very top panel that we can find everywhere. I will introduce all our panelists today. I'll start with Elizabeth Adamson. She is Associate Director of Population Health in the Novartis Foundation. She supports the implementation and impact measurement of the foundation's initiative that drive data and digital-led innovation to improve urban population health and narrow health inequities. Elizabeth holds a master's degree in politics with honors from the University of Edinburgh, concentrating on human rights, and a diploma of advanced studies in pharmaceutical medicine and development from the University of Basel. She has experience volunteering in lower and middle income countries and working in diverse locations worldwide. Elizabeth brings nearly 7 years of accumulated industry experience in the areas of strategy and project management, sustainability planning, R&D policy, development and evaluation, and the EU and US political environment. We also have Natasha Sonderji. She is the Global Health Lead on Accenture Social Impact Business and co-leads Accenture Health Equity Center of Excellence. She has more than 18 years of experience, advising companies, NGOs, and donors on social business model design, digital health, and cross-sectoral partnerships. She has designed patient-centric solutions with leading healthcare organizations, developed more than 30 inclusive business, and advised policymakers on digital health investment strategies. And she was named a World Summit AI Top 50 Innovators in 2020. Natasha holds a bachelor's in biomedical engineering from the University of Toronto and a master in public policy from Harvard Kennedy School. We also have Dicky Settle. Dicky has 20 years of experience in leadership and development of digital technologies, data systems, and their enabling environments in more than 20 countries and global organizations. Mr. Settle is PACT's Chief Digital Officer and Director of PACT Center of Digital and Data Excellence, setting digital transformation strategy for the organization and leading more than 90 staff over a 80 million portfolio or project and investment. And we have Alice Liu. She is the Capacity Development Director and Partnerships Lead for IDER, the International Digital Health and AI Research Collaborative. At IDER, she is managing a project to support AI for health researchers in low and middle income countries in the implementation of responsible and gender responsive AI, and leading a collaboration with WHO to develop a competency framework for digital health. She has over 15 years of experience working at the intersection of technology, business, and development for global health, digital financial services, and agriculture in more than 20 low and middle income countries. Alice began her career in the technology sector in California, managing large teams to deliver multi-million-dollar e-commerce data warehouse and customer relationship management system. And she earned her MBA from the Yale School of Management and a Bachelor of Science degree in Computer Science from the University of California, Santa Barbara. And I am the moderator today for this special and intense and interesting panel. My name is Daniel Ochoy. I am the Executive Director of the Central American Health Informatics Network. So I want to ask to our panelists to turn on their cameras, and we will start these very interesting discussions. And we start talking about the Broadband Commission report, The Future of the Virtual Health and Care, where several of us, or all of us, we work together in several discussions led by the WHO, the Novartis Foundation, and with the extraordinary work done by Accenture around what is the virtual health and care in the current context that we are living, and what is the path for the future. So we will start with this topic, given all the concepts that we are using globally at this moment, like digital health, e-health, telehealth, telemedicine, etc. How we can understand the virtual health and care in the current context, especially during this pandemic of COVID-19. So I would like to pass the floor to Natasha, if you want to start with this discussion. Thank you very much.
Sure. Thank you very much, Daniel, for inviting us all to be here today and to have this important discussion. As you said, there are a variety of terms and concepts that exist in the healthcare landscape, from e-health to mHealth to telehealth. And most of these terms indicate the type of technology that's being used to solve a healthcare challenge. And many of us, including the WHO, tends to place them within the broader umbrella of digital health, that field and practice associated with the development and use of digital technologies to improve health. Now, most digital health supports what we call traditional health and care delivery, which typically requires physical contact or in-person visits. But as you said, the COVID-19 pandemic played a really important role in accelerating certain aspects of digital health, those that don't require physical contact for health and care to be delivered. This is what we call the virtual delivery of healthcare services through digital means. So virtual denotes the way in which health and care solutions are delivered, in this case, remotely. It's this idea that the patient and the healthcare provider can be anywhere and they can engage at any time. So it not only expands the reach of traditional health and care by enabling last mile delivery, but it also is an essential component for complementing the care continuum. So in the recent Broadband Commission report, we defined virtual health and care to be the delivery of health and care services remotely through digital means and technology. Virtual health being the virtual measures to prevent, screen, and monitor potential individual or population health issues, and virtual care being the virtual ways to diagnose, assess, manage, optimize, personalize, and remedy existing medical conditions.
Thank you very much for this really descriptive approach related with, as I said, a lot of terms that we need to deal in the field when we are implementing digital health strategies. Regarding that, Novartis Foundation has a very important role in the Broadband Commission, especially in the Digital Health Working Group. Elizabeth, since your perspective in the Novartis Foundation, how do you see the importance of this virtual care approach, taking into consideration the current context that we are living globally?
Thank you, Daniel, for the question. And I want to compliment Natasha for such a comprehensive overview of sort of the landscape of virtual care. She was really along with the WHO and the Accenture team, really core contributors to the virtual care report that was released earlier this year. Within the working group, this is exactly where we started. All the definitions were very confusing, and we need to define virtual health and care in the context of exactly as Natasha mentioned, the remote delivery of healthcare and its services through digital means and technologies. One of the, in the context of COVID-19, where we've all saw a huge exponential increase in our virtual engagement, we also saw this and found in the report through literature reviews, analysis, really analyzed what patients and providers thought in the context of this new reality of virtual engagement. And we found that actually virtual health and care is here to stay. So 76% of patients actually wanted to continue their virtual care environment, whereas 83% of providers also wanted to continue in a hybrid environment. But I think that the significance of these numbers isn't that not only that virtual health is here to stay, but what we saw as a result of those services being rolled out in a virtual environment, and that is that it actually decreased some of the divides in certain population groups, from elderly populations to various income groups that were more vulnerable, as well as sort of decreased divides in populations with disabilities. So what the report actually was able to provide was recommendations to how to continue that momentum after or during the continuation of the pandemic.
Okay, thank you very much. You mentioned two key elements in terms of the virtual care: the patients and the healthcare professionals. That I think that we have the most important challenges, additionally to the policies, to the different regulations that we have in the countries. Given that approach to have the patients in the center of the systems, how you see, Vicky, the contribution of this report to this vision to have to close the gap in terms of the access to the population, but dealing with the challenge of the digital culture that sometimes is an important challenge for our countries?
Thank you very much, Daniel. And let me add my thanks to my colleagues for inviting us to join you all here today for this conversation. I'm particularly enthused by the question you've directed to me, because really, when you think about what is the essential interaction in the health system, it is that interaction between healthcare provider and the patient, the client receiving those services. And I think that's what we really have to understand. What are the needs and the capabilities of the healthcare provider? And what are the needs and capabilities of the patient? And in so many ways, time and space, as you heard Natasha describe so eloquently, are real fundamental barriers still around the world to patients being able to access care in a timely and reasonable fashion. Stories abound, anecdotes abound of the patients that have to travel for hours, if not a day or more, in order to access care. And when they get there, there are lines out the door and around the building because of the inability to really sequence that care and find a good time. So they'll often find themselves waiting for hours and days again to be able to receive that care. All this time being taken away from their homes, their families, their jobs, and it represents an immense challenge, is this access to care question. And so when we look at the opportunities of virtual health and care, we saw many people of all income strata around the world who would typically have great access to physical care fell under some similar constraints. We saw the health systems overburdened. We saw limitations in care due to the pandemic and various quarantine and spacing restrictions. And so there was suddenly a lot of pressure on health systems around the world to let's just move forward, right? We've been talking about this telehealth, telemedicine, virtual care, different mechanisms. Let's just go ahead and push it. This is the perfect opportunity for us to begin to realize what can be achieved now with modern technologies and around health, looking at the technologies that have been advancing so much in terms of business and internet access and the ability to have conversations like this one from wherever we are all around the world. How could that be brought effectively to care? And so we really saw that take some major steps forward. And so now we've begun to learn a lot about what providers have in the way of digital literacy and skills in order to access and use technology. We're also learning a great deal about the populations who have access or not, and various levels of digital literacy in relation to being able to access the telehealth, telemedicine, the virtual health and care, if you will, directly. And so we're taking all of those learnings and learning how to advance the access, the literacy, the equity of the ability to access these services. And also around the world, we're looking at the infrastructure and the policy guidance that this report so thoughtfully focused on, and so many of the other elements that are really going to create that enabling environment for virtual health and care as it expands around the world. I'll stop there.
Thanks, Vicky. You mentioned something very, very key to that is the policies, the public policies, the regulation frameworks. I think COVID accelerated a lot the digital, and it seemed the opportunity to use digital. But now we have the challenge of the regulations, because most of the regulations are not updated at this point. And we don't have in all the countries, especially in low and middle income countries, public policies that can support all the necessary investment and the sustainability of that interventions. What do you think about that, at least in terms of the public policies, the regulations, and how this report can provide some guidance in terms of this aspect too?
Hi, Daniel, and thank you. My thanks as well to Raquenza for inviting me to speak here. You know, the report does an excellent job of laying out the kind of the different action points that different stakeholders can take. And there are quite a few for the policymakers, the people involved in setting regulation and legislation. And, you know, in some sense, these aren't unique to the virtual healthcare model, because they are very much the same issues there that we're already grappling with in the digital health space, and now increasingly with AI. The concerns around privacy and security of the data, and you know, respecting patient rights, human rights in terms of how that data is used and the consent to use the data. You know, even beyond health, I think that there are avenues to explore with the telecom regulators. You know, in the US and in many other countries, they have the model of the Universal Service Fund, to which we all pay a little bit of a, you could say it's a little bit of a, it's a fee or a tax, whatever term you like to use, but we all pay as part of our telephone bill or our cell phone bill, that pays for you know, building out and maintaining the networks to less populated areas, because these are areas where from a financial business standpoint, the telecom operators see it's a smaller market, harder to maintain, more costly to maintain, so they might not have the incentive to build out their networks to the most rural areas, remote areas. So I think this is here to stay, as others are saying, and you know, we are seeing a lot of interest now from policymakers. There's a whole there's been a burgeoning kind of rainstorm of these policy guidelines, you know, raining down on us now from the EU, which has been leading in a lot of this, OECD, national policies are being developed based on these from these international bodies. So this is really part of a continuum of the different kinds of ways of using digital solutions, and I think that's part of the challenge, is how to create these policies so that they cover what we need, and that they have some openness and flexibility to adapt as new technologies emerge. It's probably a little bit too ambitious to say future-proof the policies, but that's the idea, as I think Natasha said at the beginning, that we know, or maybe Daniel, you said, but that regulations, that this is just with any field, that they fall behind the advance of science and technology, which advances more rapidly. So I think that we can learn from the efforts in the broader digital space to apply it to virtual care.
Thank you very much, Alice. Well, regarding the document, I asked a lot of the document to Natasha because she was behind all the construction of the document. Could you tell us more about the framework that is proposed in the document to cover these 6 policy pillars, and what are the impact expected in terms of these pillars in terms of the adoption of the framework, for sure?
Sure, happy to share more on this. So every country is at a different starting point. Every country has a slightly different approach to how they think about financing their healthcare system, that mix between public and private, the starting point that they have for regulation, and their vision for the future. So we had a difficult task to develop a maturity model that could be all-encompassing, could help guide the majority of countries in their journey towards policies and regulations that would advance virtual health and care with access and equity top of mind, but also making it specific enough that it's actually worthwhile. So we spent a lot of time engaging with experts, policymakers, stakeholders, the 75 in total, including all the brilliant panelists that you're seeing today, studying over 150 global policy documents and going deep in 23 different countries: Canada, Chile, Estonia, Germany, Israel, New Zealand, Singapore, UAE, UK, US, Uruguay, China, Colombia, Fiji, South Africa, Bangladesh, Ghana, India, Kenya, Senegal, Vietnam, Rwanda, Uganda. As we looked at all of these countries, we identified 6 key policy pillars that could help to guide the development of virtual health and care policies. And within each of those buckets, we identified sub-elements that were important. And within those sub-elements, we identified 3 different levels of maturity. So regardless of where you're starting from, you could figure out what comes next. And it's really important that one recognizes that within these 6 policy pillars, one cannot just focus on one, because so many of the policies that need to be put in place impact one another. So those 6 policy pillars are governance and regulatory, design and processes, data and technology, business models, people and workforce, and partners and stakeholders. And just like Alice said earlier, within these pillars, as you look at them and you think about the different maturity levels that we highlighted in there, so much of this isn't just focused on virtual health and care. So much of this is actually focused on advancing the collective digital health ecosystem and making those baseline investments today so that a country, a population, patients, providers can benefit from these advances in technology as they emerge.
Awesome. I think that these pillars are key. The challenge is where we can start, because sometimes it's complex to cover at the same time all the topics. In the work that the Novartis Foundation is doing with several partners around the world, including governments, that I think that this is a very focus in these people are the partner and stakeholders. How do you see this element to build these alliances with the different stakeholders in the ecosystem, Elizabeth?
Thank you so much, Daniel, for the question. I think that just to build also on what Natasha was speaking about in terms of the 6 pillars, just in the context of COVID, I think what was most interesting as well is that we found that the governments and the countries that, the reason that some countries were successful at implementing and very rapidly utilizing virtual care and health services were the ones that were able to be the most agile in their regulations and their government. So for instance, in the US, they very quickly allowed for cross-border services of providers. They had nationwide reimbursement schemes rolled out. In India, due to COVID, they had 200 million downloads of their contact tracing app. So I think that there's a huge potential to work with governments as they've seen the success of virtual care and health services in the context of COVID. And so while we've been working with governments prior to COVID, I think that they're much more willing to trust, given the not only the uptake from patients, but also providers. So for instance, right now we're working in Sao Paulo on a simulator that will help inform healthcare decision makers to make the right choices in some of their interventions that they're employing for population health to reduce and improve outcomes of cardiovascular disease. We're also working with governments in our health tech hub in Africa, in Kigali, Rwanda, where we're, instead of not just focusing on B2B or B2C customers, we're also working with B2 government. So we can employ virtual health in the context of e-governance or delivery of public health services on a country, and hopefully scale it to multi-country solutions.
Well, thank you very much, Elizabeth. I think that it's really important how to build the ecosystems. But one of the most important challenges that we face in the implementations sometimes is the design, the model, right? Mm-hmm. In terms of the design and processes, Dicky, where we start to rethink the model, because I think that we agree that with the same processes, it's complicated to be more virtual in terms of the current models, right?
Thanks, Daniel. Excellent question. I mean, and you're getting to the heart of what proves challenging about transforming health systems digitally. And that is, there's such a tendency, there's this early adopter phase where a health system begins to experiment with digitalization. And what they'll tend to focus on is, okay, I'm just going to add this on here or add that on there, or we're going to add a secure, compliant messaging system. So there's another channel of communication between providers and patients, and but without changing any of the processes, right? To your point, if you try to run an analog health system with bolt-on digital technologies, you're really not going to be realizing the kinds of efficiencies and quality improvements that you could experience with a true digital transformation. And what we recommend, we work with quite a few countries around the world in their digital transformation for health equity. And we recommend countries, of course, start with the right governance structure, which this report is so powerful for supporting. You develop a strategy. What are the priorities at the highest level that they want to see come out of the digital transformation. And, there have been strategies developed all around the world. Many countries have strategies. Most of them are out of date now. And those that aren't have pretty much sat on a shelf and not resulted in the kinds of coordinated action that can happen with a national digital health strategy. And so we encourage the strategy to be accompanied with a digital health investment roadmap. And this kind of roadmap goes beyond the strategy by taking the priorities outlined in the strategy and costing them, and then also putting them on a timeline for that priority, and then supporting the governance structures in a country to work with their investors and donors and invite them to invest into that roadmap, making a very tactical and practical tool for implementing and advancing that strategy. But getting to your point, where do you start with the processes? That's where we recommend countries really take an enterprise architecture approach. And that is finding a TOGAF, that's the Open Group Architecture Framework, TOGAF certified architects to work with the stakeholders in the health system, all the stakeholders, patients, providers, managers, policymakers alike, to really develop that comprehensive enterprise architecture. And ideally, you know how it is. There's such a tendency to leap to an app or leap to a tech or leap to a piece. If the health system can take its time to develop a data architecture first, then begin to think about the systems architecture and the different systems needed to provide different support, and then begin to think about the application architecture, what technologies could meet the criteria for that systems architecture, then they'll be ready for a more thoughtful implementation, mapping the as-is state of the health system to the do-be state, and really realize the benefits of a truly digitalized health system. Thanks again.
Awesome. I totally agree. We need the design of the architecture, and it's important to mention that in this view of the enterprise architecture, the human layer is very important because it's not only technology. Alice, you are working very hard in terms to create skills, competences in the human resources, given that we have most of the health professionals in analog mode because they are not digital natives, right? So how is the experience in terms to promote the digital literacy, to create the skills, the key skills to deliver virtual healthcare?
Thank you for that, Daniel. Yes, there's sort of it's sort of a multi-prong approach that's needed. And sometimes there's just the short-term need that drives things, which you do have to address, which of course happened during COVID. If there was a new virtual care service, the immediate need to get that up and running and train the workers, the health care workers and the providers. And then we're also working on a larger kind of more architectural approach to training by collaborating with WHO on a competency framework for digital health. And from the education world, this is actually pretty much their bread and butter. Before you even develop a course, before you start putting slides together, you first have to take a step back and think, what does it really mean to be competent, to be capable, successful as a digital health professional? Or in the case of WHO, what they are really looking at is a pyramid, if you will, of key stakeholders and actors in this space. So from the policymakers to the planners, implementers, researchers, developers, to the healthcare providers, practitioners, to the general population. So we've kind of taken on this ambitious task of trying to look at what are all the competencies needed for, let's say, the policymaker to be successful in the regulation, all the way to the general population level to have the digital literacy to use these tools, to be aware of their digital and data rights, and everything in between. And I know I don't need to go into too much detail here with because I know we want to have time for Q&A and so on. But So we're taking a few steps back and saying, what are those key skill, knowledge, and attribute or behavior areas? And the idea is that we'll map different roles into these different competencies so that there's a baseline competency, there's going to be a more, let's say, experienced to advanced level of competency in each of these domains, whether it's regulation, whether it's architecture, whether it's partnerships and collaboration. So we've got a working group that's a multidisciplinary working group meeting every 2 weeks to put this together. And you know, the goal is to have version 1 out by the World Health Assembly in May. And the different use cases we see in mind are, for instance, a Ministry of Health that wants to stand up a new digital health unit. It may have some of these skills already within the ministry, but not necessarily all of them. So this competency framework will give them that kind of a map of the different skills needed by in how, where does it fit into the different roles. You know, one of the IDARE hubs is CENS, which you may know very well, based at University of Chile, the Center for National Health Information Systems. And they actually already created their own health information systems competency framework and are using it now to look back at their curriculum, back at their digital health curriculum, and see, have we addressed everything that's here? And also working with the private sector to create job definitions that then incorporate the required, you know, definitions of competency, and then they can bring the curriculum in to make sure it delivers on those competencies. So so there is a kind of a lot of different approaches you can take, from the short and immediate term needs to the larger, bigger picture that will set up a you know, a country or a health system, a hospital system for the long term.
Awesome. Well, I think that we have covered a very good all the 6 pillars in different areas, because at the end of the day, all are connected, right? But there is an interesting word in the title of the document, the future, right? Alice mentioned something very important, the short and middle term. What are we watching in terms of the future of the virtual care? Natasha?
So my vision for the future of virtual health and care is a world where technology expands the reach of our traditional health and care systems by doing exactly what we've talked about today, expanding the reach of our traditional healthcare system, getting to the last mile, complementing the ways in which we use in-person care. It's a world where all can benefit from it. So Elizabeth talked about how the report shows that there are virtual health and care solutions that can actually help us to address the equity and access gap. But that requires a very thoughtful implementation, design, partnerships, et cetera. If you look at what happened during the COVID-19 pandemic, the majority of solutions actually exacerbated the access gaps and inequity gaps that we see today. We saw gaps based on age, based on the urban-rural divide, based on the social group that you were part of, based on your primary language skills, based on your disability status. So many challenges remain. So that vision for the future is one where virtual health and care can be accessed by all. It's a world of access and equity. What that future looks like for each and every country, in my opinion, will look a little different. Like we said earlier, every country has a slightly different vision of how healthcare should be delivered. Personally, I get a lot of inspiration and excitement when I look at the country of Rwanda. So for those that aren't familiar with Rwanda, they've made incredible strides towards universal health coverage with a community-based health insurance program where citizens pay health premiums based on their socioeconomic status. And it currently caters to over 88% of the 12 million population. What's interesting is that in 2020, they established a 10-year partnership with Babel Rwanda, who they were already working with to date. But their goal was to bring Babel's telehealth services to the entire population. And as a result of this, they saw a 5 times increase in the use of virtual health and care adoption between 2020 and 2021. What's also interesting about Rwanda is that if you look at that time period between 2020 and 2021, during the initial phases of the COVID-19 pandemic, they didn't have to enact a whole bunch of different policies around telehealth, virtual health and care. They already had the foresight to put many of these policies in place. So one of my panelists mentioned earlier that, those countries that were able to take advantage of virtual health and care were those that were agile. I would build on that and say those that were able to take advantage of virtual health and care are those that had the foresight to put in place the brilliant strategic plans that Dickie talked about, costed them out, and actually slowly worked towards them over time. The best time to deal with an emergency is not in an emergency, it's to plan for it in advance. And so to me, the future of virtual health and care is one where we all have the foresight in making the investments today so that we can improve health and well-being for our global population tomorrow.
Awesome. Elizabeth?
Thanks, Daniel. And Natasha, I couldn't really agree more, but I would even add to that we have to move from a reactive to a more proactive system of working, of living. But not only that, I think we need to move from being just proactive to being predictive and ultimately preventative. And right now, only 3% of government spending is used on preventative health. We're living in a time where we treat sickness, not preventing sickness. And a lot of some of the exacerbated divides that we saw during COVID from, in access or affordability gaps in the future will hopefully be also realized through more data-informed decision-making from health practitioners to prevent and to address some of the vulnerabilities of those in low and middle income countries that can't afford devices. This is one area that the foundation is very passionate about, and one I am as well. And we're working right now on a project, AI for Healthy Cities, where we're using data and AI to analyze the drivers and the roots of problems for the most vulnerable populations. And we just recently launched one of our initiatives in New York City as a pilot to hopefully be rolled out in low and middle income countries in the coming years.
Thank you very much, Elizabeth. Dickie, the future, how is the future?
All right. Well, I'm in a rare and exciting position. Just my previous colleagues, Elizabeth and Natasha, have spoken so exceptionally well to the policy space, where I normally focus in the policy and equity space. I get to focus a little bit on what I rarely do, the shiny, the tech. How are things going to evolve? What's it going to look like? I know when people hear the future, that's what they're poised for. So let's see if we can deliver a little bit. To talk about the future of virtual health and care from a tech perspective, got to kind of really understand its full scope. And I know we've given quite a bit of an overview, but really want to capture some unique aspects of virtual and health and care. And to Elizabeth's point, even though it's only 3%, virtual health and care captures preventative as well as curative. services. That's as opposed to, say, telehealth and telemedicine, which are more typically in their definitions used to focus on that care service that's provided between provider and patient. But virtual health and care in its vision goes further. It also covers asynchronous as well as synchronous care. One thing that's really hard to do outside of the normal care environment is to avoid the need for a provider and patient be in the same place at the same time. And that's what the traditional, again, telehealth, telemedicine sees is simply kind of video or audio interconnection, just facilitating that synchronous care event. But with really effective virtual health and care systems, you can begin to use the emails, the chats, the messaging services. And so you can begin to have a more spaced and time interaction that's more efficient for providers and patients to engage and interact at times that are convenient for them. It also encompasses the use of remote and even continuous diagnostic tools such as wearables, like smartwatches or even implantable devices. And what's really going to be exciting in the coming years are some of the new and coming technologies such as virtual and augmented reality that will create the increasingly new capabilities for remote care. And that's where we really start to get into the shiny and the speculative, but it's coming quick. It's changing very quickly. So in thinking about that, virtual, augmented, mixed reality models and these technologies in combination with the increasingly sophisticated wearable and other health sensors will really advance the ability of the medical professionals to diagnose issues at a distance. And beyond that, advances in AI and yes, even robotics, if you're paying attention to what our friend Elon Musk is working on, that's going to really make it possible for the healthcare providers to have more robust remote diagnostics, medical telepresence, even remote manipulation, maybe someday even surgery. Removing not only need to get to a tertiary care center for acute care, but also addressing the risks of potential human error in the delivery of some of these services. It all sounds kind of sci-fi and way far out there. Consider the smartphone as we know it today didn't exist 15 years ago. And now most health workers that I encounter, at least around the world, use one on a daily basis. And that's in all countries. I have met very few healthcare workers who do not currently have a smartphone. And that's only 15 years from conceptual innovation, only the most elite being able to afford and own one, to it being ubiquitous across health systems around the world. So I think we're going to see the same thing. The AR and VR technologies, they've already begun the same way. When you look at Meta's platform or some of these other platforms, a few early adopters are beginning to explore and define what is possible, much as the first buyers of the iPhone back in 2007. You're going to see this grow very quickly in the next few years, with prices starting high and coming down just as quickly as the technology spreads and democratizes, continuing the ongoing digital transformation of everything we do, including, and in our case, especially health. As for the question we started with, the language will continue to evolve as well. Someday we won't be talking about virtual health and care. It will just be health and care as we know it in the virtual age.
Awesome. Well, Alice, how to assimilate all this innovation for the health professional and the population for the future of the virtual health and care.
Yeah, I of course echo all the thoughts and concerns and possibilities of the future that my fellow panelists have already expressed. I was thinking some of the things that that Dickie mentioned about the kind of the futuristic view of virtual training. I mean, there's all kinds of interesting simulations, virtual anatomical models for med students, virtual ground rounds that doctors are doing, like an iPad mounted on a robot that's moving from bed to bed to bed, and the doctor is in a remote area conducting rounds. And we will see more of this. So I think there's some in the future. Something that IDER thinks about a bit is how do we close the gap then in how technology is advancing so quickly and in health. And now we need to look at the academic environment, work with med schools to incorporate digital health training, incorporate data science training, AI machine learning training. And because more and more, as we all can see, we are already not even leveraging the data we have, and we're going to be generating even more and more data. And we obviously want to use this for good. So that's something that we think about a bit is as the the educational environment of the future, between med schools, between scientists, technologists, the computer science and engineering schools. How do we bridge those gaps so that the next generation can really help move us forward. So that's that's what I think is really want to create that transdisciplinary kind of skill sets amongst these different stakeholders. And because the future is here and it's going to keep evolving. Turn it back to you guys.
Thank you very much. Well, the time is over, but I think that we have a very interesting document. I invite all our attendees and all the people that is hearing us to read the report. It's a very valuable asset to understand the present and the future. The future is now, as we said. So I would like to thank you to our panelists, Natasha, Elizabeth, Dicky. Happy to see Dicky with us. I appreciate your effort. Alice, because especially Alice had to travel a lot lastly, so she was with us. So it's a miracle that the virtual can help us to be all together in the same place. So thank you very much. We appreciate your time. I invite you to keep with us. We have the next session in a few minutes. It's related with the digital literacy. So we will have several colleagues from the different universities in the Latin American region talking about the challenge of the digital literacy in our region. Thank you very much. I'm looking forward to having you in other virtual spaces. Thank you.